Observing the shoulder. First, I would ask her when she hurt her shoulder, how long it hurt, did she feel anything, what she does, what does she do that makes it feel better, or what makes it feel worse. Has she ever heard it before? Has she ever hurt her other shoulder? Compare both of them. Some other questions. Okay, now I'm observing the shoulder. First, I would look to see if there's any deformity compared to both sides. If there's any bruising, if it's swollen, if one's drooped and the other one isn't. If she, like, just her basic movement, if there's any difference, or if she's, like, kind of guarding against one side, anything like that. Okay, now I'm going to palpate. A little down here. Alright. Touching. Sides. Oh. Stop. That's the end of my palpation. Okay, and now I'm going to do a few special tests. Backdrop. Correction.
I'm doing an elbow evaluation. First I would ask what's going on, when it happened, where it happened, how it happened, what she was doing. I'd ask if there's previous history, like if she's done it before, if she ever hurt the other side, if there's anything going on with her other elbow. And then I ask about pain on a scale of 1 to 10, if she can pinpoint, or if it's just an area, what kind of pain, if it's aching, dull, sharp, burning, anything like that. If there's any time of the day that the pain gets better or worse, or certain things that make it better or worse. And then I do observations. So stand like this. I look at carrying angle, look at the epicondyles. Go like this. Look if everything's lined up under here with the epicondyles and the electrons. And then palpation, I would palpate the epicondyles, well, the electrons on their border, and then the radial head. And I compare bilaterally for everything. And then sensation. And then felt my foot down. And then do the reflexes. I'll show you where they are. Up here. And here. And then we'll do special tests. So we'll do valgus and varus. You do this, and then you can go like this, connect to the next, this one. And then now checking if there's tingling down here from the ulnar nerve, and then go like this, try to break it, go down, for tennis elbow, little league elbow, and then hold this, and you're looking to see if there's recreates any pain in the ulnar nerve, and that's it. Okay.
Okay, today I'm conducting an evaluation of the hand and wrist, and the most important thing that you should do first of all is take a thorough history. So you would ask the athlete questions like, what is going on, when exactly did you hurt it, how long has this been going on, what were you doing when this injury occurred, did you hear any pops, anything like that when you happened, did you fall on it, what was the mechanism of the injury. And also, then you would have the athlete pinpoint a specific location of pain. Also with pain, you want them to describe the pain. Is there any shooting or radiating pain? Is it sharp? Is it dull? Achy? Anything like that. Anything like that can indicate a certain injury. Also, you would have them give you on a scale of 1 to 10 what the pain is. And then 2, you would of course ask them what makes it better, what makes it worse. Anything like that, and if they've done anything for the injury, have they taken ibuprofen, seen someone else, anything like that, any compression, and then of course you would ask if they've ever injured ever injured that hand or wrist before, and then of course you'd ask them if they've ever injured the other side. After that, after you take a history, you move to observation, and with hand and wrist, you're going to be observing for a couple things. Of course, swelling, ecchymosis, things like that, but also deformities like Boutonniere's deformity, jersey finger, stuff like that. You can also have the athlete make a fist, and you can look at their MCP joints, or metacarpal pharyngeal joints, looking at the angle, and have them clench their fist, and if the angle doesn't increase, then that can signify problems with the 4th and 5th mets. So that's a good thing to observe for. After observation, you're going to move into palpation, and first of all you would do bony with the hand and wrist, and it's important to start up at the elbow where your epicondyles are, because the flexors and extensors of the hand and wrist attach up here. So you feel the epicondyles moving down, the radius and ulna. You've got the styloid process at the bottom of the ulna, the Lister's tubercle at the bottom of the radius. And then you would palpate the carpal bones. A good way to find your carpal bones is to make the athlete spread out their fingers basically and find their anatomical snuff box. And if they ulnar deviate, you can find the scaphoid, and from there you can palpate the proximal carpal bones, which are the ones that are most commonly injured. So you would palpate the carpal bones, then move down to your metacarpal bones, and then of course palpate the phalanges, making sure that they can bend their fingers normally, things like that. After bony, you move to soft tissue. Of course you can follow the flexors and extensors down to the wrist, and you would also be looking at things like the ligaments and tendons and stuff like that. So after palpation, you would move to reflexes, and the way that you would test, and of course you'd compare bilaterally. But after that, you move to reflexes, testing to see if there's any differences on either side, moving up the hand. And then you could also test on both sides for reflexes. The reflexes that you could do would be the biflex reflex, and of course you'd have a reflex hammer, but I'm just demonstrating biceps here, triceps here, and then the brachioradialis right here. You could test those for anything that could be wrong. And then you would move to special tests and manual muscle testing. One test that you can do for the forearm and wrist is Tinel's test, and that's testing for carpal tunnel syndrome. You can have them do Finkelstein, so can you make a fist but tuck your thumb and actively do this. And then you can also do that passively, and that's looking for tendinosynovitis, or inflammation of the tendon sheath. You can also have them make an OK sign and try to break them out of it, basically. And that's testing for weakness of opposition or a UCL sprain. Then you could also, for manual muscle testing, what you can do is have the athlete go like this and try to break them out of flexion. Also do extension, try to break them out of that. And then of course, act like you're shaking my hand and try to move my hand. So doing pronation and supination and comparing to both sides. And that concludes my eval.